Hello, everyone. My name is Nario Cantu, and thank you for tuning in for the Friendly Pharmacist podcast, starting now. Hello, everyone. Welcome to today's episode of Friendly Pharmacist podcast. I'm your host, Nario Cantu, on healthcare policy changes and what they mean for patients, pharmacies, and the broader healthcare ecosystem. It's no secret that healthcare policy has evolved constantly, and these changes ripple through every part of our industry, impacting everything from how care is delivered to how it's accessed and paid for. Today, I'm going to unpack some of the recent developments in healthcare policy, focusing on changes in insurance coverage, access to care, and health reform initiatives. Let's start with the big picture. One of the most significant shifts we've seen recently is in insurance coverage, particularly with Medicaid expansion. Several states that had previously opted out have now decided to expand Medicaid under the Affordable Care Act, extending coverage to millions of low-income Americans. This is a huge step forward for access to care. On a related note, there's been a major push to cap insulin costs for Medicare beneficiaries. For patients managing diabetes, this has been a literal lifesaver, reducing financial stress and ensuring access to vital medications. Another transformative development is the ongoing transition to value-based care. This shift emphasizes patient outcomes rather than the volume of services provided. It's designed to improve care quality while reducing costs, a win-win in theory, but it also requires significant adaptation from healthcare providers. Pharmacies, in particular, are now playing a larger role in care teams, focusing on metrics like medication adherence and chronic disease management. And let's not forget telehealth. During the pandemic, telehealth services skyrocketed in popularity, and many of the temporary policies enabling this shift are now becoming permanent. This is a huge win for patients in rural or underserved areas who might otherwise struggle to see a provider. It's also opening new doors for pharmacies, which are increasingly partnering with telehealth platforms to offer services like virtual consultations and chronic care support. Let's take a deeper dive into these changes, starting with insurance coverage. Expanded Medicaid means millions more Americans now have access to health care, including preventive services and essential medications. For pharmacies, this translates to increased patient volume, but it's not without challenges. Medicaid often comes with complex formularies and lower reimbursement rates, which can strain pharmacy operations. To navigate this, pharmacies need to optimize their billing and reimbursement processes while continuing to provide exceptional patient care. Now, onto value-based care. This model is fundamentally changing how pharmacies operate. No longer is it enough to dispense medications efficiently. Pharmacies must now demonstrate their impact on patient outcomes. This could mean tracking adherence rates, reducing hospital readmissions, or even collaborating with healthcare providers in new ways. While this creates opportunities for pharmacies to become integral to care teams, it also demands investments in technology and data analytics to track and report these outcomes effectively. Telehealth, of course, is another game changer. With expanded Medicare coverage for telehealth services, more patients than ever can access care from their homes. For pharmacies, this creates opportunities to integrate telehealth into their offerings, perhaps by partnering with platforms that allow virtual consultations for minor illnesses or medication management. However, challenges remain, from navigating interstate licensure to ensuring parity laws that require insurers to reimburse telehealth services at the same rate as in-person visits. But with every challenge comes opportunity. Pharmacies that adapt to these policy changes can carve out new roles and revenue streams. Offering services like medication therapy management, immunizations, and chronic disease support not only benefits patients, but also strengthens the pharmacy's position in the healthcare landscape. Technology is a key enabler here. Whether it's upgrading pharmacy management systems or investing in patient engagement platforms, digital tools are essential for staying competitive. So what practical steps can pharmacies take to adapt? First, stay informed. Healthcare policy is a moving target, and it's crucial to keep up with the latest developments. Join professional organizations, subscribe to industry newsletters, and participate in advocacy efforts to ensure your voice is heard. Second, invest in technology. Whether it's for billing, data analytics, or telehealth integration, the right tools can streamline your operations and enhance your offerings. Third, build partnerships. Collaborating with healthcare providers, insurers, and telehealth platforms can open up new opportunities for your pharmacy. And finally, educate your staff. Make sure your team understands these policy changes and how they impact daily operations and patient care. In closing, healthcare policy changes are inevitable, but they don't have to be overwhelming. By staying proactive and embracing innovation, pharmacies can not only survive but thrive in this evolving landscape. Let's seize these opportunities to improve patient care and strengthen our industry for the future. Thank you for joining me today, and I hope this discussion inspires you to take the next steps in adapting to these important changes.